Thank you so much for the opportunity to have a discussion about undergraduate programming in One Health. It's been an area of close interest to me for quite some time, and I always enjoy the discussion around how to do this and whether to do it and how we can do it better. So I welcome the opportunity and any feedback that people have. This talk might be a little bit different than maybe some of the more research-oriented One Health talks that you would have in this series, but I actually think it maybe isn't that different because I think the way we develop and offer undergraduate programming or graduate programming, in fact, should be a scholarly kind of endeavor. And it is, in fact. We kind of gather as much information as we have available to us at the time. We construct what we think are the best programs we can, but we never really, it's really a hypothesis. And we're then in the process of evaluating and modifying as we go along. So to me, it is very much a scholarly approach that we try to take. So what I wanted to do today was give a bit of an overview of the Bachelor of One Health that's offered here at the University of Guelph. I realize there's a mixture of audience members here, some of which may already be familiar with parts of the program and some not familiar with it at all, so I hope you bear with me if I cover some old ground in a few cases for some of you, and hopefully it will be a coherent story for the rest. So in addition to talking a little bit about the Bachelor of One Health, I'm hoping to kind of link that back to a broader question, which is how we go about building capacity within One Health, capacity to implement One Health in a rigorous way, and also to think about the challenges associated with developing interdisciplinary programs at the undergraduate level. That in itself is a broader issue, and I think I like to think of the Bachelor of One Health as a bit of a case study for that. What I wanted to do specifically is I wanted to start by just briefly putting the Bachelor of One Health within a broader context, and that is around building capacity in One Health, which is there's a broader call for that kind of important step in terms of implementing One Health, transforming One Health from a very appealing concept into something that can be implemented in a rigorous and a consistent way. And then I will, as I mentioned, use the Bachelor of One Health as a bit of a case study. I'll talk a little bit about the rationale for the program, how that came about, so a little bit of history there. I will try to outline some of the major aspects of the program, just giving you a sense of what it currently looks like. Talk a little bit about where it's at right now. We've been running for 4 years now. The students are now entering the 4th year of their programs, the first cohort that is. And we'll sort of just take a quick look at kind of how things have gone so far. And then we'll wrap up just with a few thoughts, few reflections about the lessons that we've learned about offering interdisciplinary programs at the undergraduate level. At that point, I hope to have any kind of input or thought from audience members about the challenges associated with developing programs like this at the undergraduate level. And even if there are any students listening, I always love to hear their input from the inside as to how they think it's going. I would be completely remiss if I gave you the impression that somehow the Bachelor of Health is my project. I am here kind of presenting the work of a whole lot of people. And so I crammed it all on this single page just to acknowledge the many people that have been involved, including the development team that assembled the program largely as we see it now at the outset, the Bachelor of One Health program and curriculum committees. Both past and present members are listed there that basically provide the oversight for the program on a pretty much a monthly basis. The Program Advisory Board, we do have an external board, a small board of external people from a variety of different sectors that meet with us annually, usually, to give us feedback on how we're doing in the program. And I also wanted to acknowledge a number of administrative personnel, especially in getting the program launched in the first place. So I want to acknowledge Kate Dewey, who was then the One Health Institute director, a number of deans for the 4 colleges that are partners in this program, and then all the 8 departmental chairs that were involved in the initial launch of the program back in 2022. I would maybe make special mention of the development team since they did a whole lot of work. Heather Pollock, Katie Clow, Beth Finnis, Larry Goodridge, Amy Newman, Jane Parmley, Stephanie Rosen was our student representative, Travis Steffens, and then myself. And this group worked pretty diligently right through the pandemic to get this launched. And it was an amazing interdisciplinary group in itself, and that was a lot of fun to work with. Okay. I don't think I need to provide a definition for One Health for this group, but I'm going to do it anyway so that we are kind of all on the same page. I think it's an important starting point for, and you'll see in a number of ways. But basically what I presented here is just the definition as provided by the One Health high-level expert panel, which is, of course, the advisory group that was identified on behalf of the quadripartite international health organizations, so the World Health Organization, United Nations Environment Program, World Organization of Animal Health, and Food and Agriculture Organization. So all of these large international organizations identified an advisory panel, and that panel has taken all sorts of interesting steps towards advancing the philosophy behind One Health and also the practice. So this is their definition. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. So by definition, One Health is a trans and interdisciplinary approach in that it relies on our understanding of relationships between these different pillars of health and cultivates skills that are able to work across those boundaries. And that's my link to the whole interdisciplinary question, I guess, that I raised at the outset. The whole concept of One Health, of course, is being widely adopted, I would say, especially at an international and a national level, but we're also seeing it at regional and local levels. But the question still remains, how does this concept translate from a compelling concept to a mechanism or an approach that is implemented to address very specific problems? And the One Health high-level expert panel drew this figure to try to illustrate their way of thinking of it. You can see One Health in that central part of the diagram. But the point that they're making is that in order for us to move from concept to action, it's going to require some important things. Specifically the 4 C's that they call communication, collaboration, and coordination amongst sector experts, disciplinary experts, and the stakeholders and rights holders associated with the community. So that's a very important part of their sort of platform, that One Health doesn't just happen. It has to rely on some important, mostly forms of communication to make that work. And then they also add the 4th C, which is capacity building. And that's really the one that I wanted to kind of zero in on today. Now, the quadripartite produced a One Health joint plan of action that you can easily find online. And they talk at length about the capacity building part of One Health. And I just wanted to, I've kind of distilled what they've said into 3 main areas of capacity building that they feel are required in order to actually move One Health into action. The first is we need policy frameworks and we need organizational structures to facilitate One Health thinking. That if you have policies that are working against that grain, that just makes it that much more difficult to implement One Health approaches. Second is methodologies and tools. So the specific analytical approaches, the decision-making tools that are needed to apply to specific problems, to to turn One Health as an idea into actual actions. And then lastly is training. And there it's all about then producing a new generation of One Health thinkers that have the that understand the mindset and they understand the skill set to understand these different pillars of health, their interactions, and to have the competencies to seek collaborative and community-centered solutions. So that's basically the way they portray the need for capacity. And of course, educational programs in One Health have been developing at a relatively brisk pace across the globe. But it's not necessarily even. I just wanted to show you this little pie diagram, which is based on some informal information from the North American One Health University Network on programs in North America, just to give you a sense of how educational programs are developing at the university level. So this is strictly from the perspective of universities. You can see here, just again, reminding you this is sort of a crude measure, but there were 30 different programs identified in Mexico, US, and Canada that used One Health. Sometimes it was public and One Health, various variations on that. But the interesting thing that comes from this is that the majority of the programs at this stage are graduate-based, either certificates, mentorship programs, or master's and doctoral programs in One Health. So almost about 70% of the programs sort of fall into that category. At the undergraduate level, there's some interesting patterns. One is there's actually a surprising number of minors. So these are programs that are secondary areas of study. So the students typically would, as part of their undergraduate, have some specialization or major, and then they're adding on the One Health as a sort of an add-on to that, as an additional area of study. Typically a smaller number of courses associated with those areas of study. What jumps out, though, is the relatively few full-on bachelor programs. And the three that I've included in this diagram includes the one I'm going to talk about today. The other two, one is the honor specialization in One Health at Western, which is part of their Bachelor of Medical Science degree. And then the other is at Auburn University and is part of a veterinary program. So we actually have, in the end, you'll see three quite different approaches to undergraduate education in One Health. So all that kind of raises some important questions, general questions, I think, for universities overall, and that is, why are there so few bachelor programs? What are the benefits? What are the barriers? How do we build capacity in One Health through undergraduate programming? What should such a program actually look like? And that was really the set of questions, hi Saoirse, we were faced with at the early stages with the Bachelor of One Health. So to provide a little bit of historical context about the development of the Bachelor of One Health, it all started, I don't even know the date, I think it's about 2017, when the provost and a VP academic at the time proposed a new strategic priority in One Health at the University of Guelph. That turns out to be a very important decision, in my opinion. Once that decision was made and endorsed at the university level, it led to the development of the One Health Institute. And that institute, I kind of think of it as a bit of a clearinghouse for all things One Health and a coordinator of all things One Health on campus. It has three major mandates. One is to promote high-impact research through a diversity of expertise across this campus related to One Health, to build a One Health community, both internal but externally to the university, and then to promote the development of educational programs in One Health on campus. And that leads us to the idea of a bachelor's degree in One Health. Now, there were two, I would say, fundamental questions that underpinned the direction we went with the Bachelor of One Health. The first is there a place for One Health as an undergraduate program, or do students need a home discipline first? So this relates to a long-standing debate about how one learns interdisciplinarity. Does one require a disciplinary expertise in order to appreciate and implement interdisciplinary? Does that come first? Or is it possible to promote interdisciplinary thinking and skill sets in parallel with a discipline? And you can read the literature. It's completely polarized. There's a lot of debate about which way is the right way. And the answer is there is no right way. And that's sort of interesting in itself. But it may be partly why there's some hesitancy about developing a Bachelor of One Health or an undergraduate degree in One Health. What we did is kind of adopt the view that as an undergraduate program, that is an amazing kind of venue for promoting both disciplinary and interdisciplinary skills simultaneously. It has the curricular space to accommodate the sort of development of both of those areas at the same time. A minor, maybe less so, but a full-on four-year degree, you can do quite a bit. And that decision was supported by a number of interesting papers in the literature that argued that interdisciplinary training in parallel with discipline had some direct and measurable benefits for students. Specifically, increased student engagement was observed. Disciplinary humility, so this ability to look at problems from multiple perspectives rather than through the eyes of one discipline. So that idea of disciplinary humility became possible and was measured as much stronger within programs that have a strong interdisciplinary component to them. Tolerance to uncertainty, being able to work with complexity, and that's certainly the case in One Health. A systems level perspective, which kind of is related to the disciplinary humility. It's seeing the bigger picture, seeing the components of that bigger picture and understanding relationships and synthesizing kind of knowledge across boundaries. And then lastly, a higher level of comfort with collaboration. Because again, they're not wedded to one particular disciplinary perspective. All of a sudden it becomes less threatening, less or easier to actually work in a room with multiple perspectives. And I think the one other idea that emerges from the literature that I just wanted to flag is it's interesting that in a number of cases, the authors argue that having that interdisciplinary learning in the program actually improves their disciplinary knowledge at the same time. And it really comes back down to around to level of student engagement with these kinds of real-world problems. The second major question was, how do we maintain a balanced emphasis on human, animal, and environmental health and their biophysical and social determinants? So this was also a kind of a major turning point, I would say, early on about how much balance are we aiming for and how do we go about ensuring that there is a balance of perspectives from the human, animal, and environmental pillars. And the approach that we took there was to try to maximize that balance, and the way to achieve that was through developing a new standalone degree program. Rather than embedding it within a science degree program or an arts degree program, it was going to be its own entity, which gives us flexibility to build One Health from the very beginning. We're not having to satisfy other requirements at the same time. And also design admission requirements that welcome students with interests in social science, science, or humanities to this program. So it allows us to open that up a little bit. And then the second sort of outcome of that decision was that this would require us to collaborate widely across campus, to rely on the expertise that comes not just from one department or one college, but from multiple colleges. And that's exactly what we did, both in the development stage and then in terms of oversight that's happening now. In terms of development, we had 4 different colleges represented at the table in that development committee. College of Biological Science, College of Social and Applied Human Science, Ontario Veterinary College, and the Ontario Agricultural College. And then, now, as we've continued to roll along and we're operating, we function with a partnership among 8 different departments from those 4 colleges. So this is how we ensure that the perspectives of environment, human and animal, and social versus biophysical perspectives are represented and continue to be maintained in the program. Just a quick note about the development. I would say that once we'd sort of sorted out those big questions, the development committee got on with doing the hard work, and this little timeline is not that critical, but just to tell you that we started this at really in earnest, the earliest part of 2020. We worked right through the deepest part of the pandemic, meeting weekly to work on the development of this program. We had a proposal brief ready to shop around by the fall of 2020. That involved a whole lot of consultation with a lot of different levels, from ADAs to deans to department chairs to students, trying to get feedback on the model that we had developed. And then we had approval for that program by the spring of 2021. So it took us basically 16 months to go from scratch to, and I was very proud of that, the rate at which we worked, and I think that was testament to the uniformity of vision amongst the members of the development team, which is an important sort of thing, and it isn't always the case. Okay, now I'm going to tell you just a little cross-section of kind of how the program actually looks. You don't have to read all these words, but these are the 2 major goals for the Bachelor of One Health. One of them is all about what it is we're trying to develop within our students, preparing students with foundational knowledge, skills, and attitudes necessary to understand, evaluate, and mitigate complex challenges at the intersection of environmental, animal, and human health. And then the second goal was really about linking the program with future directions that students might want to take. So preparing students to pursue diverse pathways related to research, so preparing them to be able to enter graduate school if that's what they are interested in, professional practice, for example, vet and human medicine or even law, and occupations in diverse work fields, so public health, environmental protection, natural resource wildlife conservation, food safety, international development, and land use planning are all sort of potential directions, not exclusively those, but those were the kinds of outcomes that we had in mind. Anywhere where there was an intersection between human, animal, and environmental health. It didn't have to be necessarily right within the medical fields. That intersection happens in so many other places. We also went through a long process of identifying the core competencies that we would be intending to develop within the program. Again, I'm not going to spend a lot of time on this, but notice that we had a number of competencies with respect to knowledge that are all about the 3 pillars and their interactions. We also identified biological and social cultural diversity as an important sort of foundation for these students. And of course, exploration of more holistic health perspectives and knowledge systems that might provide those different perspectives is all there. A large list of different skills, some of which are, I would say, core kind of transferable skills, and others are specifically interdisciplinary type skills, like systems thinking, and like some of the qualitative and quantitative methods, and community engagement collaboration being extremely important in this program as well. Okay, so here's where we ended up. Right now, we currently have the flagship is a 4-year program, so that's basically approximately 40 courses the student would take over a 4-year period. We also offer that as a co-op option. That's basically the same 4-year program plus 3 work terms, so that would be equivalent to a 5-year undergraduate program. And those 3 work terms all happen after the 3rd year in the program, which is a little bit different than some programs. And the work terms are in succession. So the students would take one in the summer, one in the fall, and one in the winter consecutively. And then they return for their 4th year of coursework. We also created a minor. So we thought we are probably trying to accommodate 2 different types of students on this campus, the ones that really want that full One Health experience, and the others that are specializing in something else but are interested in how One Health might augment, I guess, the way that they think about their own disciplines. So that's 10 courses, and students in that have opportunities to take a number of the core One Health courses that the 4-year program students take. Here's my cartoon of basically the course structure of the Bachelor of One Health. You can see the trapezoid in the middle are the core courses. So these are all courses that all students would take in the undergraduate program. Some of them are social science-based courses, and some of them are science courses. Hence, I've split them up. And then right down the middle is a One Health spine, so a set of 4 courses that I can describe in a few minutes. But those are all courses that students would all take. And then you can see that those core courses have a fairly large footprint early on, and then this sort of dwindles as they make their way towards 4th year. What grows then is elective space as they get further into their program, and students can take their own minor in whatever they want, or they could take other courses related to One Health or in some other subject area altogether. And there's also, as depicted on the right-hand side there, an area of emphasis. So we had 4 different areas of emphasis, which I'll describe in a second. Sorry about the text, but I just wanted to give you a glance at the kinds of core courses that students take. So I've sort of put these into 5 different themes. And then you can just glance and sort of see some of the course titles that fall within human and animal health, environmental health, the focus on social and biodiversity, and then some methods-based courses. So those form the nuts and bolts of the core that students would take. And we've relied on existing courses to do that. Yes, we're always promoting and trying to find ways to get new courses that align with the One Health degree, but we started by working with as many existing courses on campus as we can, and that could happen here because of the strengths that we do have in environment, animal, and human health. So that worked. That's why Guelph is such a suitable place, I think, for this program. The One Health spine, I can just say a few more words about it. There's 1 course each semester, and the last year it's a full 1 credit, so it's like a double weighting for that last course. Starts, basically I think of these as integrator courses. So the students are basically learning that disciplinary information and some kind of cross-disciplinary in their core. This is where all of that gets applied to One Health kinds of challenges. So initially it's introductory in terms of what it is and what basic systems thinking is, and sort of hearing from various experts on One Health. It moves to a case study analysis approach, to special topics which give us some flexibility to highlight emerging issues or to work in areas that are of particular interest to students or to the faculty who are teaching them. And then the last course is, I would say, the capstone. It's where the students working most independently on a project that basically, or a theme that they were given, usually in close contact with external stakeholders and rights holders. So that's where it all comes together. At the same time, the One Health courses are critical for developing those interdisciplinary skills that we very deliberately built in those skills into the One Health courses. Systems analysis would be a key one. That's not happening too much not in a very deliberate way outside of One Health, but it's very deliberate how it's planned within the One Health courses. Project management, the reliance on community engagement and developing skills around that and collaboration are all promoted heavily within the One Health courses. This was just, I couldn't resist because I was involved in One Health 4000 the first time it was offered, just to give you kind of inkling of what happens in the fourth year course. So this was a group of students that basically were working on a health challenge that was presented to them. We were approached by a conservation authority in southern Ontario who was struggling with water quality as it flows from a particular watershed out into Lake Huron. All sorts of E. coli issues, sedimentation issues that were creating a number of issues. So it was clearly a health problem here, and the students then undertook a complete analysis of the activities and management strategies of that watershed in order to identify ways to improve the quality of water that's flowing from that watershed. So they worked with a client, I'll use that word loosely. There were also the collaborators on the whole project to basically understand the problem and then identify kind of approaches that that watershed manager might be considering. So they followed a problem analysis model. Started with basically just understanding the problem from the perspective of human, animal, and environment. Understanding who the players are, who the end users are in that particular locality. They go through a problem reframing. Once they've talked to a lot of the people in that community, they start to identify specific problems that are more urgent or higher priority than others. They start to zero in on those problems. They go through a whole solution ideation phase and then ultimately produce a document with recommendations and a kind of action plan for that organization that has a One Health perspective from beginning to end. And there's lots of things to talk about there, but I just wanted to quickly show you, some of the things that happened during that. Some of the highlights, I would say, for the students was, first of all, the whole systems analysis and digging deep into what this system is, how it works, what are the components of it, and as I said, who the players are in it. A bit of an eye-opener for them, I would say, in terms of the complexity that was involved. They spent a lot of time consulting with community members. Some of them are mentioned there, from health units to farmers to ecologists to wildlife managers, to hydrologists and other aquatic people. So they talked to a lot of people, which was maybe the most impactful part of what they did in that course, hearing from them what is currently being done and what is currently not being done. And then that led to a whole series of recommendations, a fairly lengthy document and analysis with it. And I listed that just because it was really interesting that most of the major recommendations that came from them were about capacity building within the watershed and having structures and people and training and communication in place to make things happen in a different way. So that was very exciting to see how that unfolded, and I think they got a lot out of it as well. Finally, area of emphases, I'll say really quickly. We do have 4 areas of emphasis within the program. Students have to select one of those, usually by the end of their second year, if not earlier. Disease complexity and health, environment, food and health, policy, economics and health, and culture, society and health are the 4. And you can sort of see by that 2 of them may be a little bit more science heavy and 2 of them are more social science heavy. And that was deliberate in that we were trying to create opportunities for students to explore different aspects of One Health depending on their real interests and passions. So this is all about just giving students a set of recommended courses that give them a little bit deeper dive into one particular area. Each area of emphasis has a progression of learning in itself, starts with some kind of basic foundational things, and it moves more to application and then more towards independent study as you go through. I will say that this is a challenge because to give students access to upper level courses in these areas often requires prerequisites. And this is one of the challenges of an interdisciplinary program is that do you have the space that's for students to get the prereqs they need to get into the more specialized courses. And in this case, we do have a set of prerequisites associated with the first 2 AOEs and a different set for the second 2 that students start to take to prepare them to sort of progress further into the more specialized courses in each of those areas. Okay, that's basically the snapshot of what it looks like. I did want to kind of give you a quick update on kind of where things are at right now, so the current status. I will say that a lot of the information that I'm going to show you just a glimpse of it, but we spend a lot of time monitoring this degree, trying to understand what's going well, what could go better, and here are some of the tools that we use to do that. We have an annual entry survey, so we learn as much about students as we can when they come in. We have surveys that are given to second year and to fourth year exiting students every year. Again, trying to understand their perception of whether the learning outcomes are being achieved in the program, their basic experience with the program, what they like about it, what they're struggling with. So we do that on a regular basis. The instructors of the One Health courses meet regularly to ensure there's good alignment across those courses so that there's a real nice clean progression and that we're emphasizing different skills appropriately at the different levels in the courses. The program committee I already mentioned meets regularly to kind of think about all the feedback we get and whether there's some things we can be doing. And I also wanted to mention there is a memorandum of agreement, which is also unusual, I would say, for most programs at the University of Guelph. Because we have 8 different departments serving as partners, this is important for ensuring everybody knows what their commitments are and kind of prevents what I'll call backsliding that can happen or straying over time. It just reminds everybody what their commitments were, and if there needs to be a change, then there has to be a deliberate discussion about how that looks. So I'll just show you a couple things. These are application rates for the first 4 years of the program, and then I've shown you some preliminary data for 2026. So it's not quite formal or official there. I think the good news here is that we've seen about a 40% increase in applications starting from 2022 to 2025, and it appears that our application rates are going to be strong again this year. So that's very encouraging to me. One thing we find with a program called Bachelor of One Health, there is a lot of uncertainty about what is that, or I've never heard of that before. And so I think there's a little bit of hesitancy maybe among some high school students to make that leap. And so we're trying hard to build awareness about the program. But in the meantime, you know, I think there will be some caution about jumping into a program that they don't feel they know a lot about. So there's good news there that we're seeing growth. And that's true for co-op as well as non-co-op. You can see there that the co-op typically gets a higher rate of application than the non-co-op. That's a tricky thing because there are a finite number of positions that our co-op office can kind of guarantee in any one year, which places some limits on how many students we can take as co-op students. If we had more positions that we could be assured of, then we would be able to grow the program more than it has already. Just quickly, I was going to say another good news story relative to other programs on campus. We're in a pretty good shape in terms of the percentage of students that pick the Bachelor of One Health as their first choice program. Even though I said there's some hesitancy, the ones that know that they're interested in more holistic approaches to health, that's what they want, and they know it, and they pick it as their top choice. And that's good. From an enrollment point of view, of course, as students, different cohorts enter into the program, we've seen progressive growth in the program. We're basically at 200 students right now across all 4 years. I think our original projections were that we would be maybe about 280. So that was a bit of a shot in the dark, but I think we're still going to work hard to try to get the numbers up a little higher. But we're going in the right direction. Some good news information in terms of basic student success. Our retention rates from year 1 to 2 are amongst the highest of any program undergraduate program on campus. So really, really strong. Student quality is amazing. The percentage of students that were on the Dean's List in this particular year, 24-25, also relatively high. We ask students about their overall reactions about the program, and so far all the students are moderately to very satisfied. So that's good news. We do break that out and we learn about more detailed kind of feedback, but that overall, that's a very rewarding thing to see. Of course, we're just in our 4th year now, so we have very few graduates to speak about where they're ending up. We do have a few, but I will say that the students have told us about their aspirations, and you can sort of see they're pretty diverse, but actually the most common thing is to hear is interest in the professional schools. But public service, graduate school, and even private industry or not-for-profits are also high on their list. So pretty diverse. In the absence of any graduation data at this point, I did want to show you kind of this is a very dense slide, but to give you a sense of where students are going in their co-ops. And I also see this very positive. First, the success rate for students getting positions, which is not guaranteed, has actually been very high in BOH, and my discussions with the co-op office suggest that they think that these students are mature and are having success because of their approach to their positions. And that might be because of the kind of student we're attracting, or it might also be because they're students that are now finished their 3rd year. So they've got maybe a little more confidence, a little more under their belt before they're applying for co-op. But we're seeing them go in all sorts of different places. I've kind of categorized them into over here on the left, so you can see a number of positions with universities, very diverse all over the place. But also positions that fall quite nicely within human health, food security and safety, veterinary medicine, animal health, and environment. So exactly where we'd want to be seeing them going. And discussions with the students have been very positive that they are seeing good connections between what they're doing in their positions and One Health. And of course, they're encouraged to reflect on that during their work terms, but it seems to be going quite well. The range of positions within those different categories is all over the place as well. I'll let you scan that and get a sense, but it's very diverse. But it reflects the flexibility, I guess, that we imagined would be in a One Health program, and it does seem to be playing out in terms of the kinds of positions students are seeking. Okay, I better wrap it up. Just lastly, to talk very quickly about lessons for success. I guess this is the way I look at it, is that having interdisciplinary programs at the undergraduate level brings all sorts of opportunities and strengths, not for the students, but it also is, it reverberates back on the faculty and staff who are playing a role in that. Because they're strong because of the diverse expertise that support them. And I would also say even there's potential there for, when you have multiple partners across campus, there's a potential for some resource efficiencies that can support a program like that any one department might not be able to handle. So I think there's real opportunities there, and there's certainly space to develop disciplinary and interdisciplinary skills at the same time. But I also wanted to acknowledge that interdisciplinary programs can encounter resource and policy vulnerabilities. They're less common on campus. They're not rooted within single departments, which is our primary kind of governance or academic model. And that can sometimes make for vulnerabilities for interdisciplinary programs, as I say here, especially in times of fiscal restraint. Because departments, let's face it, they have obligations to support their core mission, their core discipline, and sometimes that can put these interdisciplinary projects at risk. And so that means we have to do certain things to try to work against that. In terms of the key elements of success, I would say I've just listed my top 4 here. The first is I actually think that having the institutional level vision for a strategic priority in One Health made all the difference in making this happen. It creates a readiness and an openness across campus to see a program like this go forward. So I think that was actually very critical. Consultation and communication with all the partners is absolutely essential, and it's at a higher rate than a typical specialized degree program might be. Because there are so many players across the campus, it does require some additional effort to keep everybody on the same page and moving forward. Like any program, champions are critical, and we've been so lucky on the faculty, the staff, and the student side that are real ambassadors for this program and work hard, do a lot of things outside of the minimal to get the word out, to support it in numerous ways. And so I think that's something that's made a huge difference. And then one thing that I didn't mention that I just wanted to slide in here is that I actually think that the academic advising side has been critical. We were fortunate to get a dedicated program counselor associated with the BOH. That has gone away now. But for the first 4 years, that person made the connections for students between what their programs, how to navigate their programs, and also tapping into resources and opportunities across campus. It's not easy as a student to see all these things when they're distributed across many colleges and departments. So the academic advisor is playing such an important role in doing that. And so I just want to kind of make a special note of that. And then lastly, just in terms of going forward, I think a lot about institutional capacity and what are we doing at an institutional level that facilitates the development of interdisciplinary programs, and are there barriers there that can inhibit these kinds of experiences? I think we should be working hard to find ways to support initiatives like Bachelor of One Health. A lot of what we do depends on the continued participation from the departmental partners. They have to be able to make faculty and staff available to sit on oversight bodies. They have to provide people to go to recruitment events, et cetera. And so we rely heavily on their commitment. And that's an ongoing, it's work. We have to keep making sure that they're plugged in. I talked about increasing awareness amongst the high schools or even more mature students and other programs. That's ongoing for us, is to make sure we get the word out about what One Health is and what we can provide students if they were to come here. We need that to keep healthy. And then lastly, just again, from my perspective as the chair of the program committee, I just think this is a big experiment still, and it's ongoing, and we have to keep working hard to understand what's working and what's not, and keep evolving, I guess, with students and with One Health. And I think I better stop there. And thanks so much for your attention.